Hello, the concept, true level, peak level, and therapeutic index are crucial concepts in pharmacology for medication as vancomycin, gentamicin, that are used for in the hospital and other nursing and medicine settings. We're going to take those examples, vancomycin and gentamicin, because they are effective against resistant bacteria as a MRSA and other kind of preventive treatment, for example, for peritonitis, for endocarditis, also used for in case of vancomycin for catheter infection related and another kind of complicated bacteria. Gram positive for in case of vancomycin and gram negative in case gentamicin are different groups with similar reactions or side effects, but both have a narrow therapeutic index. So we have a question for you. We have a patient that was admitted in the hospital 2 days ago. The name is Rosa. She is a 53-year-old woman. She has a history of type 1 diabetes. Also, she has been a smoker for 15 years. And she was admitted because have peritonitis with MRSA. And the doctor recommend her provider vancomycin. But today, during the fusion, she started complaining of itching, of flushing on the face, as you can see. And the question is this, the name of this syndrome in case of infusion rate with vancomycin, the physiopathology, and also that is this, what is the difference between anaphylaxis and this kind of syndrome, and what should the nurse should do and the health provider should recommend to do in case that the patient have these kind of reactions. Okay, you have 1 minute. Again, this is Rosa. We're going to see and use those kind of example concept with her. Okay, Rosa, sit down here. Thank you. Well, okay, now we're going to talk about this kind of reaction that is a Redman syndrome. As you say, Redman syndrome is a reaction that can appear during the infusion rate with vancomycin in case that the infusion rate was administered less than 1 hour. It's recommended according to the guideline, our experience also, that it should be more than 1 hour. The infusion rate is different, this reaction, than anaphylaxis. We should first assess the patient as a health professional, assess the patient in order to rule out that the patient have an emergency situation, as in this case that Rosa have all the vital signs within normal limits. And then we're going to slow the infusion rate when we assess the patient and we consider that the patient have no life-threatening situation. In case of anaphylaxis has appeared, for example, as a reaction of penicillin or another kind of cephalosporin or another kind of antibiotic or medication. We should stop the medication, the infusion, call the health provider or call the first response team, and administer EpiPen according to the doctor's prescription. In this case, Rosa now is with cetirizine or cetirizine, that is an antihistaminic, because remember the physiopathology of the Redman syndrome is the release of the histamine, no IgE histamine releasing, that occur due to increase of or rapid infusion rate less than 1 hour. Remember, recommending rate is more than 1 hour or 2 hours. So another concept working with or providing those kind of medication is the true level, that in case of vancomycin and gentamicin is the lowest dose of amount of the medication, for example, vancomycin, that appear on the blood, and the blood should be drawn 30 minutes before the next dose. According to the guideline from the American Infection Association, American Physician Association, Nursing and No Practitioner Association, it recommending The guidelines say that for in case of vancomycin, depending of the patient situation, depending on the patient condition and the fact that can affect the metabolism and excretion of the medication. And in case of vancomycin, the trough level is recommended to draw the blood 30 minutes before the next dose, and it's a question that appears on exam also, but before the fourth dose, not the first, the second, no, the fourth. For example, now Maria and Rosa will have the fourth dose today. Now, within 30 minutes, I'm going to see the order, the prescription, and I will see that I should draw the blood from Rosa to know the trough level, the amount of vancomycin that is inside the blood, to know, para conocer la cantidad de vancomycin que tiene Rosa en la sangre, y ese es del trough level, que es el mínimo dosis que aparece en la sangre antes, 30 minutos antes de la próxima dosis. Esa es una pregunta para gentamicin that appear in HESI and another kind of exam. At what point, at what time should the nurse draw the blood for gentamicin IV to know the trough level? 30 minutes before the next dose is the concept of trough level. Peak level is used also for insulin, for also other kind of medication, is the maximum concentration of the medication, and is different, for example, as you know, the site of administration. If it's an IV, they have less don't have any barriers, and the medication going to reach the maximum level to a faster way that through oral than it to pass through the stomach, the first pass effect of the liver, be binding through the proteins many times. So need an entire process, but the IV is direct to the blood. So therapeutic index, remember, that is the desired amount of blood, the quantity of medication that is between the range of a minimum effective concentration of the medication that is effective to inhibit the bacteria cell wall, and also between the toxic concentration that produce, for example, nephrotoxicity, ototoxicity, and another kind of side effect that frequently appear due to the vancomycin. Those medications are used for the hospital. This is another question for the exam, for the real life, are prescribed and used in the hospital for methicillin-resistant bacteria. Remember, the gram-positive bacteria that are bacteria that contain, that are have a cell wall in comparison with the negative bacteria. We want to talk in another video of the difference between both, and that take tinctures of purple color after they using the gram, adding the gram stain, and it's due to the presence of peptidoglycan inside the cell wall. So the vancomycin, that is a glycopeptide group, tricyclic glycopeptide, work against this kind of bacteria, but sometimes they have there are some resistance of those kind of bacteria, because inside the hospital, you know, there are a lot of diseases, and also they can mutate, and they can have they have some resistance, against some kind of medication, and for this reason we should closely monitor the side effect and also the function of the kidneys, nephrotoxicity, ototoxicity. Vancomycin also, the patient vancomycin also can have some dizziness, can have also some hypotension, fatigue. Also, remember the kidney function, that is symptoms and signs that are polyuria, too much urine, producing too much urine, oliguria, there is less of production of urine depending on the amount of input of water. But we should monitor closely glomerular filtration rate and creatinine clearance that are more specific than the blood urea, nitrogen, And also we should assessing the patient for those kind of syndrome, Redmond syndrome during infusion, and also anaphylaxis. Follow us in the other video to work with those concepts. Rosa is doing well now. It's better, Rosa, now? Okay, so thank you very much. If you have any question, you can discuss with us. You are invited to discuss with us this kind of concept and question. Thank you.